It is 8:30 now here on this Tuesday. We've got Dr. April Ritz joining us today here on the show from Effingham Pelvic Health and Wellness. Good morning.
Good morning.
How are you doing this morning?
Doing well.
Glad to have you here. And we're going to talk about prolapse today.
Yes. So, for those who don't know what prolapse is only a condition that, well, it can occur in men, like a rectal prolapse can. So, I have some men in the clinic with that issue, but primarily for today's talk, we're going to be talking about prolapse in women.
Okay.
So, I'll
All right.
explain more as we go. But
Very good.
So
Very
this
good.
is not the opposite of anti-lapse.
no.
Okay.
So, so in our clinic, we see men, women, and children with like bladder issues, bowel issues, sexual health, pain, back, hips, pelvic floor, all that stuff. You guys know that.
Oh, yeah.
But today I really want to talk about prolapse because we had several women calling our office recently about pelvic organ prolapse, and some people are being told incorrect things. So I just wanted to jump on today and really talk about this because 1 in 2 women will have prolapse based off like a vaginal examination. And what a prolapse is when the pelvic organ, so whether it is the bladder, the uterus, or the rectum, starts to fall or descend into the vaginal canal.
Okay.
So causes, risk for this could be a big risk factor is pregnancy and having a vaginal delivery or pushing for more than 2 hours. But other ones are, we see women who work in factories or are working for like UPS or Amazon. They're picking up heavy packages all day. So lifting heavy and holding their breath or lifting improperly can contribute to this. Holding the breath while exercising. And then other risk factors, menopause for women is an increased risk factor for prolapse, as well as hysterectomy, because with a hysterectomy, you lose a lot of the tissue support that's kind of helping hold the organs up. So with that, you can actually get where the vaginal vault starts to kind of collapse on itself.
Okay.
Obesity, because of extra weight, puts more pressure down on the organs. Constipation, if you're straining and bearing down and pushing and holding your breath, that's again going to put more pressure down on those organs, as well as I've seen some patients who just have like a lung issue and a chronic cough. Coughing all the time just puts, if you think about it, like people don't realize how much pressure that puts down on the pelvic floor until you really start to focus on, oh yeah, that like I do feel that sensation down there with coughing.
Yeah.
So some of those are some of the causes or risk of prolapse.
I'll be
Okay.
darned. You know, I always think when I'm thinking about lifting and doing it correctly,
Yes.
my back. But now you're telling me you need to be thinking about your front too.
Yes, you need to be thinking about the floor, the pelvis. You should be thinking about your abdomen and your back as well. So yeah, you're not lifting. Don't lift with your back. Lift with your legs.
Yeah.
But also, we with all patients in the clinic, if they have prolapse, I am having them start with like lighter weights, and then we progress because a lot of the patients we're seeing too have children or grandchildren. And if you're lifting kids that are 20, 30 pounds, 40 pounds, that's a lot of weight. And if you're doing that every day, we should be able to blow out, engage our core, engage pelvic floor as we're lifting our kids and then relaxing those muscles.
Okay.
And some of our patients who don't have children, like lifting heavy flower pots or, things like that. So
Yeah. Now, what are some of the symptoms? If you think you may have this, what can you look for?
Yeah, so like I said, 1 in 2 women have prolapse, but not all those women are symptomatic. So most people don't realize they have this until they start having symptoms. And that's why one of the things we do in our clinic for every woman, even if they don't necessarily have symptoms or they don't realize they have prolapse, we are asking these questions to see if they have any of these symptoms. We're also doing an assessment because a lot of times they are asymptomatic and we want to prevent it from getting worse and becoming symptomatic. So some of the common symptoms right away when I hear somebody saying, like, I have a pelvic heaviness or I feel like there's something right there when I wipe. That is probably the prolapse where the bladder, either the uterus or the rectum is falling downwards and it's right there at the vaginal opening.
Okay.
Bladder symptoms would be that they don't feel like they fully empty their bladder.
Oh, okay.
They go pee, they stand up, and they're like, oh man, I have more. I need to get more out. That's a symptom of prolapse, as well as urinary leakage and urgency can be a symptom. Sometimes with like intercourse, it feels like there's something in the way because there is. It's falling down to the vaginal canal. With bowels, if it's a rectocele, they will have incomplete emptying with bowel movements.
Okay.
So they don't feel like they ever get it fully out. And some of the patients will actually have to splint where they have to push on that tissue with their hands to try to fully evacuate.
Okay.
Because the tissue is just not strong enough to help support and get everything out.
Okay. Very good. And Again, like you mentioned, pregnancy, heavy lifting, things like that. That's a lot of the holding breath while exercising. You mentioned that as well.
Yes.
So a lot of these things can cause this, I guess.
A lot of things can cause it, and then that's why the goal is if you do have it and you're asymptomatic, there's a lot of things you can do to prevent it from getting worse. Stop holding your breath. Make
Mm-hmm.
sure your bowels are good and consistent and you're not straining. Yeah, just making sure you're lifting properly, making sure you're doing exercises properly, because that's a big one.
Mm-hmm.
Actually, a pet peeve of mine is going to exercise classes and seeing all these older women that I know are in their um, mid 40s, 50s, and then like those in menopause, they're doing all these crunches and high level core exercises. And I'm sitting there, they're all doing their exercises, and I'm sitting there thinking about all their pelvic floors, thinking, how many of these women have prolapse, and
Yeah.
how many of them don't realize, like them holding their breath, or they're not engaging their pelvic floor, and it's just pressure every day pushing down on that
Mm-hmm.
prolapse.
Yeah.
So we do see a lot of women in our clinic who have prolapse, and they want to make sure they can get back to their exercise classes appropriately.
Mm-hmm.
And we actually will check them while they're doing exercises to make sure that prolapse is not coming down while they're doing planks, while they're doing bicycle crunches, things like
Mm-hmm.
that. But most women are doing way too high level core exercises than what their body, core, and pelvic floor are ready for.
Okay.
I like all the assessment information, April, because I've been seeing a doctor or two lately, and about the time they ask me the 13th question and I'm starting to get irritated, I'm starting to think, now I know why they're asking these things.
Yes. We do 2-hour evaluations with all of our patients,
Yeah.
and some patients are like, is that needed? For the most case, it is. There are some patients we'll do 1 hour with, but we have so many questions and it all ties together. People don't realize that your bowel plays a role in constipation, or like your period health plays a role in period pain and the symptoms they're having. Like we go into detail on bladder, bowel, sexual health, past childbirth history, even if it was 40, 50 years ago, because it does play a role into symptoms people are having.
Okay.
Yeah.
Very good. Now, if people do want to make an appointment with you, how's the best way to do that?
Yeah, so best way to make an appointment with us is you do not need a referral. Most
Mhm.
insurances do not need a referral. You can just call us directly at 217-705-5077. And Lori or Paige will be more than glad to talk to you over the phone, kind of get your symptoms and let you know how we can help.
Okay.
So give our office a call. And you can also, if you are just curious, want to learn more about our clinic, you can follow us on social media, Effingham Pelvic Health.
Okay. Very good. And you always have some kind of classes all going on. What do you have coming up?
We have a lot coming up. So this Thursday, actually, we will be going to Casey Coffee Company, and Tiffany Mosley, who's an advanced practice nurse. Her and I will be presenting on perimenopause and menopause, like the symptoms and what you need to know to ease those symptoms. That is a $25 class, and that is this Thursday. And then coming up on Saturday, November 2nd, we have a pregnancy and postpartum workout class from 8 to 9 a.m. at our clinic. That is $10. And then Tuesday, November 12th, we have a free class. A pediatric occupational therapist is coming in, and we'll be talking about tips for toys and talking about storage, children's attention with toys and play,
Okay.
and just very good information that all parents should know. So that is a free class on November 12th. And then November 19th, I have my menstrual health class I do a couple times a year.
Okay.
And this one I am actually combining. It is for teens, preteens, and moms. And then I'm going to go a little bit longer at the end, and it's going to be focused more on adult women and their menstrual health issues and like infertility. But
Okay.
that class is $25 per family. And all of these classes you can find on our Facebook page, or you can just call our office to get information and to register. But you can also register through Facebook. There's a link directly to our booking page.
Okay. Very good. Very good. And of course, you guys seem to be always growing and stuff. Are you looking for some help, maybe?
Yes. So I am looking for a pelvic floor physical therapist. So our wait right now is a little bit longer than I would like for people to get in. So I am looking for a pelvic floor physical therapist. 24 to 36 hours a week would be fantastic. And then we are also hiring somebody for kind of like office manager, front desk as well. That would be a full-time role. So both of those positions can be found on Indeed. And as well, if you go to our Facebook page, you can also email me, April at Effingham Pelvic Health, like your resume and cover letter.
Very good. And if people don't know where you're located at, where are you?
Yes, we are 101 West Evergreen, so corner of 4th and Evergreen, and there's been some construction going on. They've tore down all the trees in the back, and they're filling in the ravine with dirt. Effingham Asphalt's doing that for us. We're adding more parking.
Oh, that's
So,
great. That's great.
yes.
That's great to hear. So,
Yes.
yeah. Because, yeah, you're right there on the corner there.
Yeah, I got to tell you, April, I was by yesterday. I saw the sign outside. Very clever.
At your cervix, yes, at your service.
That's great. That is great.
We try to keep it very appropriate, but also some humor. So
That's good. That's real good. Well, thanks for coming in and talking to us today, April.
yeah, thank you guys so much for listening about these women's problems with prolapse. So
Yeah.
Oh, no.
Very good.
Helped all of us. If nothing else, some guys out there saying, "Oh, now I know what she's going through."
Mhm.
yes, for sure.
Exactly.
All right. Dr. April, always a pleasure. And